this I soon learned to be what they call phantom pain. Phantom pain is very real, disturbing. I had many sleepless nights. Entered another pain clinic to which, to no avail, I still suffered the same symptoms of this phantom pain. It was relentless. I would stay up rocking all night, 1 o'clock in the morning to 5 o'clock in the morning, changing positions, nothing would work. And I had home health nurses coming to the home, helping me out with wound care, other wounds. And I would express to them about this pain that I was having constantly. So it wasn't until this one particular home health nurse, she made mention that she knew of another amputee who had the same issues. However, that other patient had something done, a surgery or whatever, but to where she no longer experiences this type of pain. So I was like, well, that would have been nice for the doctors to have done to me before we got to this point. However, that wasn't the case, and I really didn't know the process of it to the extent that I do now. And just by happenstance, I happened to have an appointment with my orthopedic doctor. Having gone through all this pain, I expressed to him, I said, Doc, is there anything that you can do about this pain? I heard about this surgery called TMR, and it's as if as soon as I said that to him, he looked at me just like, he said, hold on. I'm telling you, he walked right up the hall, came right back within about 4 minutes with another doctor. And this doctor happened to be Dr. Wimalawansa. And they looked it over, asked me a lot of questions, looked at my limb. And before we knew it, I was going back into surgery to try to get this phantom pain corrected. Once I met with Dr. Wimalawansa, they got me in surgery because I had 2 surgeries that they did at the same time. So now I felt totally debilitated once I came out of that surgery because I couldn't use any one of my legs. It was almost worse than the first. At least I had one good one the first time. However, after this surgery was conducted by Dr. Wimalawansa and his partner, I didn't feel any pain. I would get a pain here, a sensation there, but few far and in between. Nothing like I initially was experiencing. Dr. Wimalawansa would always tell me, like, well, don't get too excited. Give it about 3 months, 2 to 3 months, so we can get a true assessment of what's going on. So I was like, okay, but I think it's gone. Because I want anything to be away from that pain that I was experiencing because it was just that bad. So we went through the process, had the surgery. It was very successful, very successful. It's to the point now, and this is only 5 months removed from my actual accident. I'm back working full time, driving, getting around with no problem. I will have my prosthetic next week, so I had an opportunity to be on that. And the care that I've been receiving, from Dr. Wimalawansa and his staff has been phenomenal. It's very personal, and I recommend a doctor like this to everyone. And I really am thankful and grateful to be given the support that I've been given from my family relationship, my work relationship, my peers, and my doctor care. And if you guys have any questions, I'll be willing to answer if you have any. Other than that, it's been a ride, and I've been loving it.